welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Predictive biomarkers may support potential for personalized medicine approach in RA patients. A study published by researchers in Trinity College Dublin and St. Vincent's University Hospital proposes a better understanding of the site of inflammation in rheumatoid arthritis, which will allow for the development of new treatment strategies or predictive biomarkers which could support the potential for a personalized medicine approach. The study was published in the journal Science Advances. In India, the prevalence of rheumatoid arthritis is estimated to be 0.7%, which is higher than the global prevalence of 0.46%. The team performed an in-depth investigation of a specific population of cells, the macrophages, that reside in the synovium of rheumatoid arthritis patients, individuals at risk of RA and healthy controls. Researchers demonstrated for the first time the presence of a dominant macrophage subtype in the inflamed rheumatoid arthritis synovium, which importantly was associated with the disease activity and treatment response. Union Health Ministry releases revised operational guidelines and training manual of NAFLD. The Union Health Ministry released the revised operational guidelines and training manual of non-alcoholic fatty liver disease. According to Union Health Secretary, India has taken lead in recognizing non-alcoholic fatty liver disease as a major non-communicable disease. It is rapidly emerging as a public health concern closely linked with metabolic disorders such as obesity, diabetes and cardiovascular diseases. The release of these documents will provide a framework for health workers at all levels, from community health workers to medical officers. Addressing the session, Shri Apurva Chandra, Union Health Secretary, said that India has taken the lead in recognizing non-alcoholic fatty liver disease as a major non-communicable disease. He said non-alcoholic fatty liver disease is rapidly emerging as a major public health concern closely linked with metabolic disorders such as obesity, diabetes and cardiovascular diseases. Out of 10, 1 to 3 people can have non-alcoholic fatty liver disease, which highlights the impact of the disease. Shri Chandra highlighted that the release of revised operational guidelines and training modules reflects the importance being given by the Union Health Ministry to curb the disease. He said these documents will provide a framework for health workers at all levels, from community health workers to medical officers. He also emphasized the importance of continuum of care for people who have been diagnosed with non-communicable diseases and underlined the need for lifestyle modification for reducing the prevalence of non-alcoholic fatty liver disease. Chemically induced stem cells, islets, functionally cure type 1 diabetes in phase 1 clinical trial. Chinese scientists have realized the clinical cure of a type 1 diabetes patient by transplanting islet cells derived from chemically induced pluripotent stem cells, according to clinical research published in the journal Cell. This CIPSC islets therapy aimed at curing type 1 diabetes, the first of its kind, was performed by the medical scientists from Tianjin First Central Hospital, Peking University, Chongping Laboratory and Hangzhou Reprogenics Bioscience. During the study, a female patient who had type 1 diabetes for 11 years was completely dependent on insulin treatment and suffered from poor blood sugar control. After the transplant of CIPSC islets, she regained the capability to autonomously regulate her blood sugar. 75 days after the transplant, she became insulin independent and has remained insulin injection free for over a year. All her diabetes related indicators have reached the levels of a healthy person, confirming the clinical cure of this type 1 diabetes patient. American Academy of Paediatrics announces its first clinical practice guideline for opioid prescriptions. The American Academy of Paediatrics has published its first clinical guideline for pediatricians on prescribing opioids, including explicit instruction on how and when to prescribe these medications for pain while reducing the long-term risk of addiction. The clinical practice guideline says opioid prescribing for acute pain management in children and adolescents in outpatient settings marks a shift in clinical practice by also recommending a routine prescription for naloxone, a medication used to reverse overdose, alongside every opioid prescription. There's been a big pendulum swing in the practice of medicine over the last 2 decades, first with opioid overprescribing, then with a huge cutback in opioid prescribing, likely leaving some children's pain undertreated. said Scott Hadland, MD, MPH, MS, FAPP, lead author of the guideline. We want pediatricians to prescribe opioids when they are needed because untreated pain can lead to distress and psychological harm. At the same time, physicians need to take steps that reduce the long-term risk for addiction. The AAP Clinical Practice Guideline recommends Chinese researchers unveil new link between bipolar disorder and epilepsy. A team of researchers from the Chinese Academy of Sciences has uncovered compelling evidence of a genetic link between bipolar disorder type 1 and epilepsy, potentially revolutionizing our understanding of these complex neuropsychiatric conditions. The study, published in Genomic Psychiatry, reveals shared genetic variants and a causal relationship between the two disorders, opening new avenues for research and treatment. Led by Dr. Ming Li from the Kunming Institute of Zoology, the study utilized genome-wide association study data from European populations encompassing over 26,000 epilepsy cases and 25,000 bipolar disorder type 1 cases, along with their respective controls. The researchers employed advanced statistical method to uncover the genetic underpinnings shared by these seemingly distinct neurological conditions. Key findings of the study include a significant positive genetic correlation between bipolar disorder type 1 and epilepsy, identification of approximately 1,300 genetic variants influencing both conditions, discovery of 6 independent genomic loci significantly linked to bipolar disorder type 1 and epilepsy, a notable causal effect of epilepsy on bipolar disorder type 1. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.